Okay. Okay, so I will just start quickly. My name is Giovanna Yanache from the Harrison Public Library. It's a pleasure to have this talk today with the White Plains Hospital and Dr. Peabody. And I'd like to introduce Dina Nelson, who's the Community Relations and Event Manager at White Plains Hospital. Thank you.
Good afternoon, ladies and gentlemen, and thank you for taking the time to join us today. February is Heart Health Month, so today's presentation is on caring for your heart. Dr. James Peacock is part of the White Plains Hospital Cardiac Electrophysiology Program. Dr. Peacock earned a bachelor's degree in biochemical sciences at Harvard University and his medical degree from Vanderbilt University Medical School in Nashville, Tennessee. He obtained an advanced master's degree in patient-oriented research from the Columbia University's Mailman School of Public Health. He completed his residency in medicine and fellowships in cardiology and electrophysiology at Columbia University. Dr. Peacock specializes in the diagnosis and treatment of a wide range of abnormal heart rhythms. He's board certified in cardiac electrophysiology, cardiovascular disease, and internal medicine. Would you please welcome Dr. Peacock?
Hi, everyone. Thank you for the opportunity to speak and arranging all of this. This is a real privilege for me because lots of times when I get to see patients, I'm so focused on their acute, kind of more pressing heart issues. And we don't often get to spend a lot of time talking about the preventative stuff. And the preventative stuff, by and large, has so much more of an impact than trying to treat the acute illness. So an ounce of prevention is worth a pound of treatment. That adage is really true for these type of things. So I really appreciate the time to give us some time to talk about just focusing on the preventative side. All of my slides are taken from the American Heart Association. There is a great program called My Life Check that kind of talks about the 7 simple things that you can do in life to really think about your overall heart health and maintain it. So the way I'm going to set up is this. We're going to talk about the 7 things. 3 of them are more clinically based, including blood pressure, cholesterol, and diabetes. And then 4 of them are lifestyle, eating healthy, managing your weight, moving more, and quitting smoking if you're a smoker. And what I'll do for each one is I'll pause and see if you have questions. So anticipate after each of these sections, I'm going to pause for a little bit. I'm going to ask for questions. You can unmute yourself, and then we can try to make this as interactive as possible. And then at the end, we'll have some time, obviously, then to just have conversations. The most important thing is I want to be able to communicate with you and answer any questions that you may have. So a little bit about me. I am, as you heard, a cardiologist and electrophysiologist. I am a father of 2 girls. They are 12 and 9 years old. We live in Westchester. And, I think about heart health with them and, myself and my family, quite often as I'm going through my patients and thinking about ways that I can do things better at home. So hopefully I can share some of those experiences with you as well. Okay. Am I controlling the slides or should I say next slide? Okay, next slide. Great. So the first thing we're going to talk about is blood pressure. So there are 3 clinical things that you need to be looking for or paying attention to for your cardiovascular health. These 3 kind of metrics that we're looking at are the most important clinical metrics to get right, to really create a lifelong, heart healthy clinical values to make sure that your heart stays healthy for a long period of time. So the first one is blood pressure. It's probably one of the most important. So if you go to the next slide, the first thing we'll do is really introduce what a blood pressure is. So your heart has 4 chambers. 2 of them on the right pump blood to the lungs, which oxygenate the blood. And then the 2 chambers on the left pump it to the rest of your body. And the pumping it to the rest of your body is what delivers that oxygenated blood throughout your body, and it sends it back to the right side to get reoxygenated. And you've probably all seen these kind of blood pressure numbers before, whether you got it checked at your own doctor's office or, there's CVS and people have blood pressure cuffs at home. There are 2 numbers. the systolic number and diastolic number. The top number, the systolic number, is the blood pressure that you get when your heart is actually taking its beat. So when it's actively pumping, it's sending a certain amount of pressure through. The bottom number, the diastolic, is after your heart does its full beat, what pressure is left in the system. And what happens if your blood pressure is too high, if you imagine your blood vessels being like a balloon, and if you pump it up too much, it loses some of its elasticity. And if you keep that pressure too long, it also loses some of the elasticity. So what we're talking about here is the elasticity of the vessels. So we want to keep it in a range that has a high enough blood pressure to get the blood circulating, but not so high that it's stretching out your arteries too far. So the top number, again, the systolic number, and then the bottom number, the diastolic number, you can kind of see the blood pressure categories there. Blood pressure of 120 over 80 is kind of what we say is normal, or the kind of the maximum end of normal. And we usually want us to be under that number. Anything kind of in the 130 to 80 category, we consider stage 1 hypertension, and kind of in between is what we call elevated blood pressure. So the things important here are to track your levels. A blood pressure cuff is a great device to get. You can get it at any CVS or Walgreens, just to know your blood pressure at home. I don't know if you guys have ever heard of the term white coat hypertension, but that's what happens when, so I saw a hand raised there, right? And what that is when you go to the doctor's office and you see the white coat and you get nervous, then your blood pressure goes up. But actually, when you're at home and you're not so nervous around the doctor, then your blood pressure goes down. Now, while you may have heard of white coat hypertension, there's a corollary to that called masked hypertension. And this is sometimes when we doctors miss high blood pressure. So that's when you go to the doctor's office and you're actually kind of relaxed with the doctor. So you get your blood pressure taken there and your blood pressure is normal. But when you get home, it's the stress of the kids, your job, traffic, traveling, whatever the stresses are, increases your blood pressure at home. And sometimes we as physicians miss that diagnosis. So having a home blood pressure cuff where you can kind of check and record some blood pressure readings can certainly help your doctor kind of figure out what your blood pressures are doing at home. Remember, you're only in the doctor's office for a short amount of time when you're spending most of the time at home. So that's when your blood pressure matters the most. Some of the tips for success on the right of eating smart, moving more, managing weight, don't smoke, and sleeping well are going to be important. And we're going to go through them as we kind of go through our 7 values. So I'm going to leave that on the screen for you guys to read while I stop here and ask if there's any questions. So if you have a question, I think just go ahead and unmute. There's not that many of us, so we can make this an open dialogue.
I have a question. Someone told me that the bottom number was more like important to look at rather than the top number. Is that true? And what do you consider a normal range?
So that's a great question. Is this iPad Betsy? The both numbers are important. The bottom number is something, we always just look at the top number. And a lot of people just think that the top number is important because it's the higher number of the two. So they're like, well, if my blood pressure is 130 over 80, then I'm worried about the 130. I'm not worried about the 80, but you're absolutely right. The bottom number is equally, if not more important. And I'm going to go back to the balloon analogy. So, if you have a balloon and you blow it up to a certain level and it's blowing up like this, now what's going to cause that balloon to lose elasticity? Both the increased one where it puffs out, but if you keep it at a high pressure all the time and it never gets a chance to relax down to, a more manageable pressure, that also, makes you lose elasticity. So as people get older, for example, one of the things that we'll notice as physicians is the higher number and lower number separate out. And it's because the arterioles or the arteries get so stiff. So instead of being elastic, it's like pumping through a lead pipe as you lose elasticity. So you get a really high pressure and then it goes completely away because it just loses that, the vessels lose that ability to kind of contract and help you. So both are important. The diastolic number generally refers to a little bit more of how much fluid you have in you. So sometimes we'll take into account, those type of things when we're deciding on what medications to give. Any other questions?
Yeah, I have one. I
Mhm.
have a fitness tracker that records my blood pressure every hour. And I just wanted to get your take on those, how reliable you think they may be.
So Jenny, that's a great question. There is so many new consumer devices now that purport to be able to do a lot of different things. Some of them are really great. So you have to be a little bit careful in which numbers you believe. My best advice is for you to take those trackers, anything that you have that has numbers on them, and bring them to your doctor's office, even your home cuff, right? Like if you're getting readings of like 150, 160 says you're having high blood pressure, bring it to your doctor's office so he can compare, you can use your cuff, figure out, oh, my cuff says 150, 160, but my doctor's office one that's been calibrated says my blood pressure is actually normal. And that can help you internally figure out whether the devices that you got, whether it's a traditional blood pressure cuff versus like the fitness tracker ones are useful. In general, the ones that are coming from the fitness tracker that uses a light source, and that's how it works. It looks at the speed at which the blood goes through your system, are less accurate than the overall cuff ones. But it's still, any information is better than no information. So I would still write them down. And if your tracker blood pressure is following your doctor's blood pressure, then you can feel a little bit more confident that they're right.
Thank you.
Okay, let's, any other questions? Great, so let's move on to the next one. So the next one is cholesterol. So cholesterol becomes important because when you think about a heart attack, the traditional way a heart attack forms is with cholesterol plaques that form. Your heart, like any other muscle, have blood vessels that feed the muscle of the heart. There are three main ones, one from the right and then one from the left breaks out into two main ones. So there's kind of these three blood vessels that come out there. And what happens over time is that the bad cholesterol, so there's two different types. There's the high density cholesterol, the HDL, which is the good cholesterol. And then there's the low density cholesterol, the LDL, which is the bad cholesterol. So when you're going to your doctor's office and looking at these reports, that's what you're looking at. Now, the LDL one, the one that's known as the bad cholesterol, is the one that sticks to your arterial walls and develops plaques. And over time, these plaques and inflammation will create a narrowing of the vessel that eventually can break away and then cause an aggregate of platelets and other things that block up that vessel. So if you think about the three vessels, let's say these are the three vessels that are coming out of the heart. If one of your vessels goes down because of a thing, the whole side of the heart here may not get oxygen. And then that's really where the heart attack comes from. So preventatively, we want to decrease the LDL as much as possible and increase the HDL, because while LDL sticks to the arteries, the HDL helps the LDL from it prevents the LDL from sticking in the first place. So the way that we get cholesterol in our system is either we ingest it, right? We eat it from our food, or your body actually makes cholesterol, depending on kind of what you're eating. It can form your own natural cholesterols. Now, as a general rule, the types of cholesterol or fats that you want to eat that help you are the not saturated fats. And the way you can tell a saturated fat from a not saturated fat relatively easily, unsaturated fats are liquid. So you're thinking about your oils, your olive oils, your natural oils that are liquid at room temperature. The saturated fats, like animal fats and others, tend to be more solid at room temperature. So that's kind of an easier way to determine, what type of oils you're eating. So any kind of olive oil, olive oil is a great one that we love to cook with. Eating those generally have better lipid profiles than the saturated fats. The worst ones to eat are the trans fats. And you probably have been hearing that, on TVs and other zero trans fat. And trans fat used to be found in margarine. It's a unsaturated fat or fat that they converted to, it's an artificial fat basically. And that one has been shown to stick more than even the unsaturated fats. So that's an important one to look at. All right. Your healthcare provider. So in order really to check your cholesterol, this is not something you can do at home with a blood pressure cuff. This is something you do need to see a healthcare provider for, because they do need to get blood work to measure those values. And then they can talk to you about whether diet alone, exercise, or you're getting to the level where, a medication may need to be involved. Okay, so that's number 2, how to control cholesterol. And I'll stop there for questions.
I have a question.
Mhm.
So is cholesterol only determined by food, or can it also be like hereditary? Because I just don't know. Like I sometimes feel like I'm eating very, very well, and
Mhm.
my cholesterol still seems to be sort of high. And unfortunately, when I was dying, my father died of a massive heart attack,
Oh,
and my brother, it's okay. My brother had a high cholesterol, and I don't remember him eating very badly. So is it ever something that like is produced by your body, not having anything to do with food?
yes, your body naturally produces cholesterol.
So some people more than others?
Some people more than others. Absolutely.
Okay.
There are like familial stuff where people have really, really high cholesterol. It doesn't matter what they eat. Now, anyone can help their lipid profile. So the genetics are what you're born with, but people can help their their lipid profile by eating right. But the other thing that's really important is to move.
Mm,
Exercise increases your body increases the amount of high density lipoproteins, or the good cholesterol. Your body produces more of that as you move. So when I look at a blood report, for example, and I see a low HDL, I can already tell that they're not engaged in cardiovascular activity, because cardiovascular activity is going to naturally raise your high density lipoprotein, which is the good cholesterol, and it prevents the bad cholesterol from sticking to your arteries.
I see. Okay.
But great question. Any others? Okay, so let's move on to the next one. And if you think about questions from these other ones as we're going through, please just write it down, and then in between these breaks, we can certainly answer them. So the last kind of medical thing or medical metric we're going to look at is how to manage your blood sugar. So I'm sure everyone's familiar with diabetes. It's getting your blood sugar levels that are coming out of control. And the first thing we want to do is understand what blood glucose is. So the first step to managing your blood sugar is really to understand what makes your blood sugar levels rise. So when we ingest carbohydrates and sugars in everything that we eat and drink, it gets turned into sugar. So like bread, for example, may not taste super sweet, but it's full of carbohydrates that then get broken down into more simple sugars through your digestive system. So those sugars enter your body, and then insulin is a product that your body makes to drive those sugars into the cell. So there are 2 types of diabetes. Type 1 is your body cannot produce insulin. And those people we usually catch as little kids because their body's not able to produce insulin. And those children end up taking insulin supplements to substitute for their body not being able to make it. The second one, which is more prevalent, is type 2 diabetes. And this is when you get kind of exposed to so much sugar that your body becomes what we call insulin resistant. So because it's insulin resistant, your pancreas produces more and more insulin until eventually it burns itself out, and then stronger forms of diabetes come out. So here's an important thing. So you want to track your glucose levels. Now, this is, again, something that your doctor can do in the doctor's office. It's a little bit harder to do at home, but he'll measure what we call a fasting glucose. So they'll wait until you haven't eaten anything for 8 hours or so, and then get a blood stick to see what you're fasting, because as soon as I have a candy bar, for example, my blood sugar is going to go up just because of the candy bar I ate. They want to know what's your fasting level. The other thing that they can get is something called a hemoglobin A1C. It is a metric that tells you on average what your blood sugar levels were over several weeks or months, which gives us an idea of whether your blood sugars on average have been high. So, fasting blood sugar, we're looking for something under 100 milligrams. And that's, in the healthy range. Once you start getting a fasting blood sugar between 125, we call that pre-diabetes. And anything over 125, it's diabetes. Things that we can do to help is eating right, moving more, managing weight, and quitting smoking. And those are some of the things we're going to talk about in the next section. So I'm going to save those. All right. So we covered high blood pressure. We covered cholesterol, and we covered blood sugar. Are there any questions here?
Yeah, I have one. What about the sugar in fruits? Like, we eat a lot of fruits. Do I need to worry about that?
So in lots of ways, sugar is sugar. So whether the sugar is coming from a natural source like fruits or processed like candy, the amount of sugar is the amount of sugar. The benefits of eating things that are in fruits and others is that the carbohydrates tend to be a little bit more complex, not super simple sugars, which makes the spike of how much sugar you're getting a little bit longer. So you're not getting those instant spikes that you would. So an apple, for example, may release its sugar slower than the candy bar. So your body has a little bit more time to process the sugars that are coming through. But in general, we want to limit the amount of sugars we're eating, even from natural sources. And the best way to know whether your blood sugar is in the right level or not, this is where you have to see your physician, because the blood, like I told you, the hemoglobin A1C, which they measure, can give us an average of what your blood sugars have been over a couple months. So if you are worrying like, oh, I am eating healthy because I'm eating fruits and vegetables, but am I eating too many fruits and having too much sugar, then that blood work may be a good indicator, because you can overdo it even with just the natural fruits. All right, great. So let's move on to the next parts. So here are things that you can do at home. And I think that these are important pieces in your overall heart health. So we talked about some of the medical things like blood pressure, blood sugar, and cholesterol, but here are things that you can be doing at home. These are things that you can keep active every day. So doctors always say eat better and exercise more, right? That's kind of the things that we always say, but how much activity is the right amount of activity? Well, they've looked at this, and they say that adults really should be getting a total of 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity kind of throughout the week. So you can do, 30 minutes, 5 days a week, or 50 minutes, 3 days a week, however you like to do it. And the way that I like to think about what's moderate activity, what's vigorous activity? Moderate activity is, there is a test that we use called the singing test. So if you are able to talk but not sing, you're doing moderate activity. So if you think about you're jogging down the street, and if I'm able to sing a song, then that's not moderate activity. If I'm able to talk to my partner, but if I try to sing, I get out of breath, then that's moderate activity. That's a good way to just gauge and feel if you're getting moderate activity or not. Vigorous activity, you shouldn't be able to get more than a few words or half a sentence out before you're getting huffing and puffing. So that's the difference between moderate activity to vigorous activity. So again, mild activity, you can sing a song, no problem. Moderate activity, you cannot sing, but you can talk. Vigorous activity, it's even difficult to get these full sentences out. Now, as you get older, it's also important to do some muscle strength, right? Muscle strengthening. So a little bit of resistance or weight training can be helpful just to make sure you're maintaining your bone health and your muscle health. Adding intensity. So I'm suggesting that you should go 150 minutes and 75 minutes. The level that you add this intensity needs to be done kind of appropriately before you engage in any exercise routine. I probably would go see your doctor and just say, you know, I'm committed to exercising more. I want to do more. Can you help me figure out what my limits are? Because you may have osteoporosis, you may have other diseases that your doctor may not want you to engage in something like this so quickly. Now, the goal may ultimately to get up to this level, but you may need to take a little bit of time. If you have children, you know, the easy way with children is 1 hour a day. They should be moving around, having fun. So anything that you can encourage your kids to go outside, play around, run around, is just helpful to get them moving. Everything counts. So any movement counts. It doesn't have to be formalized exercising. So for example, you know, 20 minutes of vacuuming your house. So if you're cleaning your house and you're like, wow, I never exercise, but you know, you're cleaning your house every day. 20 minutes of vacuuming is like walking a mile. You know, things really can add up if you are just calculating and thinking about moving. So moving is moving. Whatever you're doing, you know, counts towards that exercise goal. So like 10 minutes of stretching is like walking the length of a football field. 2.5 hours of walking every week is like walking across the state of Wyoming over the course of the year. So like even those little things that you do can really add up. So I generally tell my patients, you know, I don't want them to run a marathon tomorrow. Well, that's not what I'm trying to tell them to do, but to set some realistic goals. So whatever you're doing now, increase the intensity by 10%, by 20%, go up week by week and listen to your body. If your body's saying that you're having chest pain, you're getting extra short of breath, you're getting lightheaded, you're going too fast, you're going too much. And this is where, you know, stepping back and talking to a doctor can be helpful. Keep going. You're not going to reach your goals every week. You know, life gets in the way, and all the things, you may not hit the 151 week. Don't give up. Just keep going. Remember, any movement is movement. And then try to find a way to make it a habit. Build it into your daily routine. Those are all important, you know, important pieces. There's little things that you can do. I mean, we in the healthcare, you know, in the hospital, when we try to encourage exercise with our physicians, we just say, hey, take the stairs. You're going up and down these flights of stairs anyway. I mean, you're going up and down floors anyways to see patients. Instead of taking the elevator, you know, take the flight of stairs up, especially if it's just one story. Those things add up. And it's a good way to just stay active. All right, I'll stop there. Okay, so let's move on to the next one. How to eat better. This is actually my favorite one because one, I love to eat, so it makes it enjoyable to talk about. I can't take credit for this because my wife told it to me, and she can't take credit for it either because she heard it from a famous chef, but I certainly stole it from my wife. So she told me that the easiest way to stay healthy with the eating is to figure out how you grocery shop. And the piece of advice I give to my patients, again, which I stole from my wife, is start your grocery shopping on the peripheral part of the grocery store. So you take your shopping cart and you go all along the perimeter of the grocery store before you ever go into the middle. And why is that? Well, on the outside of the grocery store is where all the refrigerated stuff is, right? All the fresh stuff has to be kept out there because you need refrigeration. So think about your grocery store layout. You walk in, what's usually the first thing you see? Fruits and vegetables, right? And as you walk, there's either meats, fresh meats, dairy, eggs, all of the fresh stuff is all in the outside. And then what's in the middle of the grocery store? Well, it's all the processed stuff, right? All the stuff that has really long shelf lives. And those things tend to have a lot of salt or preservatives, or really end up being super processed to be able to give them, you look at an expiration date for some of those things and it's like 2 years, and you're like, how do you keep something fresh for 2 years? Well, it's super processed. There's a lot of preservatives in it. So, making intelligent eating choices, vegetables, fruits, whole grains, beans, legumes, nuts, plant-based proteins, lean animal proteins, skinless poultry, fish, again, all along the sides and the perimeters of the grocery store. And then things to limit, the sodas, sodium, processed meats. There's the salty six that we talk to our patients about, because there are things that you don't think are salty because they don't taste salty, but in fact have lots and lots of salt in them. Bread doesn't taste salty. If you ever looked in the ingredients list of the bread, it has a lot of salt. Pizza, sandwiches, cold cuts and cured meats, soups. I mean, I don't know if you ever cooked and put salt into your soup. In order to make that water salty, you're adding lots of salt to it. Burritos and tacos and those type of things. Things to avoid, we talked about trans fat or partially hydrogenated oils. That's the key term. So if you look at the back of the label and you see partially hydrogenated oils, don't buy it. Those trans fats, those artificial fats, are terrible for your blood system. So just completely, if you're going to avoid one thing, it's just look at the back of your food label. If you see the hydrogenated oils, I would completely take that out. So I'm gonna stop there and see if there's questions, and then I'm gonna give you a couple of anecdotes that I do with my own family.
I have a question. I'm actually in the process of changing my eating. And how do you feel about animal fats? And I mean, I know that they contain a lot of protein, which is really good, but how do you feel about animal fats in terms of your health?
You want to generally limit the amount of animal fat that you eat, with the exception of fish.
Okay.
So seafood or fish in general have omega-3 fatty acids, and that has been shown to be heart healthy. So there's certain animal fats, and this is why you see the picture of the salmon in the middle of there, they're actually good fats to eat, right? And the other good fats like oils, like olive oils and other things, like the Mediterranean diet that you keep hearing about, have a lot of these kind of low density type oils in them, the unsaturated fats. So, but animal beef, bacon, pork, all of those kind of animal fats, as much as you can, you want to avoid.
And what about dairy? How do you feel about dairy?
Dairy is certainly okay. Any ways that you can decrease the amount of fats that you get from dairy is helpful. So, 2% milk as opposed to whole milk, if you want some cream, or even better, skim milk is even better, because it has all of the protein pieces of the dairy without so much of the fats and sugars. That's the way I like to think of it. The less of the saturated type fats that you have, and saturated fats are animal fats, right? Those are solid at room temperature. I would try to avoid as much as possible, even eating healthy. Now, I would rather you buy a steak, right? If you were going to eat something meat-based, see how much fat's in there, cook it, salt it yourself, rather than going to the microwave, frozen dinner with a meatloaf in it, because they're going to put more fats and other things in there that you're not seeing fresh. So at least when you are preparing your own food, you can gauge and see how much you're doing. I'm going to give you 2 helpful tips that I use. Buy yourself a small plate. So if you want some simple advice, if your plate is this big, you're going to fill up this much food on your plate, and you're going to look at that food and you're going to eat it because you don't want to waste it. Go to the store and buy yourself plates that are this big. Even if it's for you, take 4 plates just for you and your family, and just say, on a normal day, we're going to just use these plates instead of these plates. because that helps you kind of think about portion control. And let's say you're like, well, I don't know, this plate may not be enough food to fill me up. Then what I would say is put that on your plate and eat it. And then wait about 15 minutes before you fill that plate again. And what ends up happening when you eat food, your body naturally releases a hormone that tells you you're full. And if you start with a plate this size and you keep eating, that hormone doesn't come in for about 15 minutes, you've already finished the whole plate. But if you start with a plate this size, you eat it and you're like, I'm not quite full yet because my belly hasn't expanded, but you give yourself about the 10 or 15 minutes, you'll feel full because those hormones come in. Now, if you're still not full, then you need to eat a little more than you can, but at least give yourself those 15 minutes to allow your body to tell you whether that's enough or not. The other thing, and I do this, and I mentioned I have two daughters, a 9-year-old and a 12-year-old, make good habits with your kids or grandkids. It's an important piece. It's a good way of being emotionally involved and connected with your kids, to spend time with them, show them you're paying attention to them. I get, as an example, for Valentine's Day, instead of going home and buying a cake, right? That's kind of the processed food. We bought a bucket of strawberries and some baker's chocolate. And instead of having slices of cake, I sat with my kids. We made the double boiler and we kind of melted some chocolate. And we each dipped out, 1 or 2 strawberry pieces as a treat. And we knew we had, a fresh strawberry in there. They had some chocolate, but we knew how much. It wasn't that much because it was just a dipped amount. And it was a fun activity that we got to do together kind of around the table. So, if the 2 pieces of advice I'll give you is watch your portion control, right? Buy yourself a small plate, and then try to make the cooking part of your day with your family kind of a more interactive one where you're kind of talking about these things. Any other questions here?
I have a question about both coffee and red wine. I read conflicting articles. Some say they can help the heart, others no. So I don't know what the answer is.
It's so interesting. There have been so many studies that have been conflicting. And I'll tell you the conflicting part of it. Most studies have shown, both with coffee and particularly red wine, that if you enjoy them in moderation, they tend to be heart healthy. The problem is that people who have time to enjoy a glass of red wine and a sip of coffee are usually, socioeconomically, like kind of better off in that way. So it's hard to tease out the type of people that can enjoy a glass of red wine in the evening versus those who can't afford it, or they're just too stressed, or they don't have the time to really sit there and kind of enjoy it. So that's where some of the conflicting things come. What we do know is that overdoing it is bad. So too much coffee, too much caffeine can certainly induce abnormal heart rhythms, can cause problems with sleep. So you want to avoid that. And then obviously too much alcohol in any form can lead to a lot of downstream problems. What I advise my patients to do is, if you enjoy it, I wouldn't do it because of the heart health. But if you enjoy, alcohol, particularly wine or coffee, I would say you should do it. Just do it in moderation, right? And what I mean by moderation, no more than 1 to 2 glasses of wine an evening, and no more than 1 to 2 cups of coffee. But you're right. There's a lot of conflicting data on there. It's really hard to tease out because we don't do what we call randomized control studies, where we take a population and flip a coin and try to randomize them and say, okay, you drink 2 cups of coffee a day and you drink 4 cups and you drink none, and then let's see what happens over time. There's so many biases in terms of the people who self-report those things that it makes those studies tricky to do.
Also, is the red wine more healthy than the white wine for the heart? Because I've read
As I was saying that, There is a lot of conflicting data on that. There is something in red wine. I think it's called Restruf. I'm gonna mispronounce it. It starts with an R. Um, that's supposed to be a chemical that has been thought to be additive to the benefits of the alcohol. In fact, I think some companies even sell it, and they've done some animal studies where they gave really, really high doses of this stuff and showed there's like improvement in aging in like mice, for example. Uh, the short answer is we don't know. There might be some theoretical benefits to red wine in particular over the other alcohols. I would say again, if you're trying to do it for the heart health, if you don't enjoy drinking, but you're like, well, the doctor says that red wine might be healthy, I'm going to start drinking. That's not the reason to do it. Again, but if you enjoy having a glass of red wine, then know that there are studies out there that show that it can be beneficial. Red wine more than most, although a small amount of alcohol in anything is okay.
I have a question.
Mhm.
Foods that are high in carbs, some of those carbs may be fiber, and that's good for you.
Yes.
Is there a certain ratio of carbs to fiber to look for healthy foods?
Yeah, and I would say anything, any type of sugars that are coming from fruits, because they're a little bit more complex and they combine the fiber, is better than the processed stuff. And all of those are better than juice. Remember, juice is just the fruit that has no fiber in it. So if you're thinking about the ratio, that's the one that has the worst ratio. Um, the only way really to know if you are having too much sugar for them, this is where a partnership with your doctor is helpful. You know, you say you want to eat fruits and vegetables, but am I overdoing it with the sugar? This is where getting that hemoglobin A1C. And if your doctor says, you know, your fasting glucose looks great, your hemoglobin A1C, which is your average sugars over the last 3 months, have looked great, then you know you're not overdoing it with the fruits and, you know, with the fruit sugars. But certainly, just like anything else, you can overdo it with the fruit sugars as well. Things that tend to have more fiber than things that are kind of meatier. So, like if you think about, you know, the best ratio to fiber to sugars are kind of the heartier vegetables, right? Because they tend to have less sugars, which make them less appealing, and more fibers, like broccoli, celery, other things. Sweeter things tend to have the other ratio. And really to know, I want you to enjoy your food. So you want to have a mix of those. But the way to know that you're having too much or not is really to get the blood work done.
Yeah, when I look at a food label and it shows the carbs and underneath it shows the fiber, is there a, the amounts of each?
Yeah.
Is there a rule of thumb for that ratio?
There's no magic number.
Okay.
Yeah, we don't have a magic number. The higher the fiber content to the sugar is better, but there's no magic number to specifically look for to things to avoid. And again, things in moderation, right? So if there are things that you really enjoy having that have a higher sugar to fiber ratio, I wouldn't want you to not eat it if you enjoy it. I just want you to watch the portions.
What about honey?
That's a great question. You know, the two common ones are honey and sea salt. So those I'll lump them together because they say, well, doc, you know, I'm having salt, but it's sea salt, or I'm having sugar, but it's honey, or, you know, other types of sugar. Or and the way that I would say is, the honey gets broken down into the same glucose molecule that all of the other sugars get broken down into. So, you know, you really have to, again, watch yourself in moderation. Just because it's honey and has some other potential benefits doesn't mean that you can just keep eating honey, because it'll overload your system with glucose as it breaks down. The more complex sugars tend to have a longer curve where you don't get these spikes of sugar as much. And the sweeter it is, tends to be like more of a spike. So the honey is actually on the sweeter, spikier curve than some of your other kind of heartier fruits and things. And the same thing with sea salt. You know, salt is sodium chloride, whether it's coming from the sea or whether it's coming from, you know, wherever else. So those kind of healthy labels, you just got to be careful with them.
Okay.
All right. So let's go ahead and move on to the next slide. So managing weight, and we covered a little bit of this with the nutrition. So if you go into the next slide, we talked about reduced calories in and increasing calories out. And this is where those things where like the honey or the sugars or other things, you just got to be careful. You can, some people count calories. I think that's really difficult to do over the long run. I've had some patients who've used apps and things like Noom and others who've had some success. There are weight loss programs that have been shown to work, like Jenny Craig and others that are kind of helping you count the calories for you as kind of a partner. The simplest one, the portion control under number 3 tips for success, just go out and get yourself a smaller plate. Get yourself a really beautiful plate that you really love. And you're like, this is the most beautiful plate I've ever seen. And I just want to eat from this plate every single night, and make it smaller than the normal plates that you use. And that by itself makes you're eating everything that you're normally eating, but you're just having less of it. Now, if you start replacing what you're eating with the eating smart by eating around the, finding food around the perimeter, preparing it yourself, when you're adding sugars, whether it's honey or salt, whether it's sea salt, and you're seeing how much you put in, that's always better than getting the processed stuff, because I guarantee you the processed stuff has more. Increasing your calories out. So the movement, the things that we talked about with the movement is also important. So trying to balance those two factors, move more, eat less, and we kind of talk about this, and you see doctors talking about it all the time, are kind of the proper ways to make sure you're keeping your weight under control. Okay. And I'm gonna stop there for questions. The last part, I'll say, you can do too much, right? You can do too much in the sense that there are eating disorders called anorexia and others where you're eating way too little, and you can overwork yourself, and kind of ways to figure out whether you're going too far. There is something called your body mass index. It's a numerical number. It's something you should talk to your doctor about, but it's a ratio of your height to your weight. That's kind of ideal. And you can be bad on either end. So either end, you can weigh too much for your height, or you can weigh too little for your height. Gives you kind of like a rough gauge of whether you're maintaining a good weight or not. And then also with the exercise, if you're exercising to the point where you're getting injured or you're not feeling well after, then you may be overdoing it. And again, this is where tapering back and then talking to your physician about, a good healthy exercise program can be helpful. Okay, and I'll stop there.
Just a couple things I just wanted to get your thoughts on, like probiotics. What do you think of them?
There's been a lot of research on kind of your gut flora and how it affects everything else. I think that in general, having a good gut flora, and I think there's enough evidence to say this now, is an important thing. And, in the days where we're taking a lot of antibiotics and the foods that we eat have a lot of antibiotics and other things in them, it can really mess with your gut flora. The best way to help your gut stay healthy is to introduce the probiotics in a natural way. So there are ways that you can do it with pills. The problem with the pills that you buy from like a GNC or others is it's not regulated. So you don't really know what you're getting in those pills because it's just not regulated the same way food and drugs are. The natural way to get good probiotics is good cultured yogurts, right? Because that they have the right bacteria in them. They're helping to produce those yogurts. So, good healthy yogurts and things that have active probiotics in them are a good way. And just having a little bit of that can help you keep regular too.
And just one other thing. And what about fasting? Like, is it good to miss a meal occasionally or?
Yeah, intermittent fasting has been shown to be very helpful, both for weight management and kind of overall health. And, the best way to do that is you're already fasting at night, So this is the advice, and I do this too. I'm an intermittent faster. So, I eat dinner when I get home, and then I go to bed. And, the next morning I might have a cup of coffee, but I don't eat again until sometime in the afternoon. Breakfast, right? So breakfast is breaking your fasting, right? That's where the term breakfast comes from. So, you know, if you can extend out how long you do it for, the first week or so, you get pretty hungry. And then after your body gets used to it, your liver starts creating those sugars and you just become less hungry and your body gets used to it. Now, I'll give you that with a caveat. Certain people who have diabetes and other things where they're really managing their blood sugars, missing meals can be difficult, right? So again, talk to your doctor before you go into any kind of extreme dieting stuff. But intermittent fasting to allow your body to go into from building fats and proteins from the amount of food that you're eating to breaking them down can certainly be helpful. And I think it's one of the more effective ways to lose weight.
How do you fast, not eat breakfast, yet work out on a treadmill and yoga every morning if you've not eaten breakfast?
It's something that your body, so I don't want you to overdo it, right? So I don't want you to fast and then try to do yoga and run on a treadmill and sweat and then feel like you're going to pass out. So, the bottom line is listen to your body. If you're getting to that level and you're feeling like you're going to pass out, then please eat something. Please drink something. If you do this kind of slowly over time, what ends up happening is as you sleep, you get to this point where your body feels hungry, right? And then your body releases hormones to tell your liver, which has energy stores in it, to release that energy. So I don't know if you've ever not eaten for a long time, but what happens is you get acutely hungry. And then if you can't eat for some reason after a couple hours, you're like, wait, I'm not that hungry anymore. And then eventually you get hungry again. It's that I'm not hungry anymore is when your liver starts producing the energy that your body requires. So the whole idea of intermittent fasting is to allow your body to go through that cycle where you're allowing your liver to release that energy and you're not hungry, but you're still able to do everything else. Intermittent fasting, you should still be drinking though. I don't want you, intermittent fasting does not mean don't drink and don't eat. This is, still drink water, still stay hydrated, just decrease the amount of caloric intake that you're taking. And again, none of this should be extreme. So I don't want you to be like, well, Dr. Peacock told me not to eat, so I'm not going to eat for 18 hours. Listen to your body, go slow. And, if you could push it back another hour or two, see how you feel. And then, do it with the portion control can certainly be helpful.
What do you consider a time frame for fasting? 10 hours, 12 hours?
Yeah. So if you have dinner, let's say you say, I'm going to eat at 6 o'clock and I'm not going to eat again till, and you can start at like 8 o'clock, right? So that's a 14-hour fast. And then I'm not going to eat again until 10 o'clock is a 16-hour fast. I've gone as long as an 18-hour fast is kind of my longest. But somewhere between kind of at least the 10 to 14 range gets you, kind of partly the way there. And remember, you're sleeping for a lot of it anyways, right? And I would, wherever you're starting from, I would just push it back a couple hours. I wouldn't try to go to like a specific number. So if you're already doing 10 hours because of your sleeping, try to go to 12. If you're already doing 12 hours, try to go to 14. And again, listen to your body, see how you're feeling. If you're starting feeling lightheaded, like you're going to pass out, then, just eat.
Okay,
All right.
thank you.
Okay. So the last slide, and this is not going to pertain to everyone, but if you smoke, it's really, really important. I think of all the things we talked about, quitting smoking may have the most direct benefit. Smoking is the most preventable cause of death in the US. It causes high blood pressure. It causes heart disease. So about a third of all deaths from heart disease is from smoking. 90% of lung cancers are from smoking. They have all kind of carcinogens in them. Even children exposed to secondhand smoking we've been finding is causing, issues down the line. It's really hard to quit. I've had patients, including, I mean, my own parents both smoke, and it took them until the 8th or 9th try, and sometimes they quit for 2 years and they would go back on it until they finally kicked the habit. So just because you restarted smoking again doesn't mean you can't get there. In fact, most people need multiple attempts at successfully quitting smoking until, before they actually quit smoking. Things that to do is set a quit date, choose a method, whether it's I'm going to do it cold turkey or gradually. Ask for help. There are nicotine replacements and other things to help you for the cravings, and then prepare for how to handle it. And if you fall off the bandwagon for a little while, if you fall off the wagon and you end up smoking once or twice, don't be like, oh, that's it, I failed. Restart the process, because it often does take people quite a bit of time or a number of attempts to really become successful at this. All right, last slide.
I actually have a question about the smoking. I
Yeah.
used to smoke,
Uh-huh.
but I quit. So I just wanted to know, like, when I'm in the clear, like in terms of like when
Great.
the
Great
past
question.
smoking doesn't affect me.
Go back one slide. Almost immediately, you start
Oh.
gaining the benefits from quit smoking.
But
Almost
when is it absolutely not going to affect me?
You'll always have a little
I
increased
quit
risk.
7 years ago.
Yep, you'll always have a little increased risk from the smoking that you did. But
Okay.
even within the year of after quitting smoking, this is the last bullet point, your risk of heart disease goes down by half. Now you're 7 years out, so you have gained a lot of advantages from not smoking. Even after 1 week of not smoking, they have done studies to look at like oxygenation and other things about how well your lung performs. It already gets better. So it happens pretty quickly.
So
And the fact-
basically, you're saying the longer you've quit, the better off you are.
better it is. Absolutely. And the fact that
Alright.
you did 7 years, that's amazing. Congratulations.
Yeah,
That
thank
is
you.
great. That is
Thank you.
fantastic. All right. So if you go to the next slide, we're running out of time. I'll take any last few questions. I do want to say thank you for giving me the time to chat with you, and I'm really sent some pictures focused around families and things, emotional well-being, community. Those are all important things too. And if you can surround yourself with a community, whether it's family or friends that are doing kind of similarly good heart healthy things, like going for a walk with your family, or like I told you, instead of having cake for Valentine's Day, we did the strawberries with the chocolate, or sitting around the table and enjoying a good meal together. Those are all important things too. Your emotional well-being and your interconnectedness is an important part. And engage your physician with it. Your physician is a good partner to help you kind of guide through all of this. All right. Any last questions?
A question about viruses. I know that they're usually not good for the heart. Have you seen that with COVID in particular?
Yes. COVID has been shown to directly affect the heart and cause inflammation. And then patients with heart disease, particular hypertension, has been shown to be more prone to COVID. So to everyone out there, as someone who has been in the health system dealing with COVID, please, please, please get vaccinated. It has been shown to be safe. And I know that there's stories out there that says it's not, but it's been shown to be safe for almost everyone. If you look at the statistics of people who got or did not get the vaccine, the risk of not getting it and catching COVID and having a much worse result is many, many fold for. Even the Omicron one, which wasn't so dangerous, you have an 8 times more likelihood of being hospitalized, with COVID than you did if you got vaccinated. And we've even seen this play throughout New York. So if you have the opportunity to get it, I really, really encourage you to get it, unless your doctor really says you shouldn't get it for a very specific reason. Any other questions?
Can you hear me?
Yes.
Oh, okay. My question is, what do you think about the small aspirin, baby aspirin?
You know, that was, this one I would refer to your doctor. There are instances where we still recommend a baby aspirin. It has really been shown now not to help in large studies. And it's been in vogue for a long time to baby aspirin for kind of heart prevention. But unless you have a specific need for it, preventatively, we don't recommend it anymore.
Oh, thank you.
You're very welcome. All right. I think are we out of time now?
You're at 5:02, so this is perfect.
Oh, great. Again, lastly, just thank you again for giving me the opportunity to speak with you. It was a pleasure meeting all of you. I'm a Westchester native. I hope to see you around. We'll see each other in the grocery store in the fruit and fresh meat section, running around the perimeter of the stores.
Thank you so much. So informative.
Oh, you're
Thank
very
you so
welcome. Thank
much.
you.
Thank you
was
very
great.
much.
Excellent.
Right. Okay.
Thank you.
Thank you, everybody.